Herpangina. See, in the oral cavity, small vesicular eruptions will be seen. This is usually caused by viral infection. The most common cause of viral infection is herpes simplex virus. The second one being Coxsackie group of viruses, which produces Herpangina. Now, in this Herpangina, which is characterized by the presence of vesicular lesions in the oropharynx, mainly behind the tongue, that is in the tonsil and pharynx. And it affects age group of less than 10 years of age and is more common in late summer. Now, coming to the presentation, patient complaint, the parents complain the child has got fever and he is tired and he is not able to eat properly. So on examination, he will be having high fever, and examination of the oral cavity, we can see small vesicles over the tonsils and the pharynx, as you see in this picture. These are the small vesicles which is seen over the tonsillar area and the pharynx. Why I am saying repeatedly is that in herpes group, which produces herpes, which comes under the herpes simplex virus, that produces herpes gingivostomatitis, the vesicles or ulcers are mainly seen in the anterior part, involving the lips, tongue, palate. But in Herpangina, it affects the posterior part. Now, this is a clinical diagnosis, so you don't need an investigation for this. So, suppose we do a blood count, it will be suggestive of infection. The total count will be elevated and the C-reactive protein will be mildly elevated. This is a self-limiting condition. It goes off in 7 to 10 days. And we have to manage symptomatically. The child has fever, we have to give antipyretics. He is dehydrated, we have to ask the parents to give fluids, plenty of water to drink or fluids to be taken. And avoid spicy foods. Avoid hot drinks. Take rest, bed rest. These are the most important things. Usually, we don't give antiviral medication because this is self-limiting condition. Now, in more than 95% or 98%, it fades off by itself. In a very less percentage, chances of complications are there. So, what are the complications? Parotitis, meningitis, hemorrhagic problem, diathesis, or anemia, hemolytic anemia. So, suppose you have visited a doctor and he has given you all the symptomatic medication and you have gone home. The next day, if you develop fever along with that new onset of severe headache with vomiting, you have to reconsult the doctor. Maybe this is one of the complications. Suppose you have red color marks, newly developed red color marks in the body. Again, this is one of the complications. In that case, you have to revisit your doctor to manage that complication. So, Herpangina is caused by Coxsackie virus and it's usually seen in less than 10 years and it's a self-limiting condition. It goes off by itself by 7 to 10 days. Symptomatic management. That's all.